Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Side effects of ACE inhibitors. ACE inhibitors can cause side effects like cough, they can cause angioedema is seen, proteinuria is seen. One thing they cause cough and angioedema is mainly due to the because ACE inhibitors will also inhibit the metabolism of the bradykinin. So when they inhibit the bradykinin metabolism is inhibited, so because of this the bradykinin metabolism is inhibited, which states that the bradykinin is not broken down, so there will be increased increased bradykinin levels are seen in the blood. These increased bradykinin levels will cause cough and angioedema, which are the specific side effects of angiotensin converting enzyme inhibitors. Now, if the patient develops cough and angioedema due to this angiotensin converting enzyme inhibitors, then we can give angiotensin receptor blockers. We can stop angiotensin converting enzyme inhibitors and shift the patient to angiotensin receptor blockers because these bradykinin metabolism is not affected by this angiotensin receptor blockers, so there won't be these side effects are not present in angiotensin receptor blockers. Then one more important thing is in these we can shift the patient to ARBs, but if we can also treat this cough and angioedema can be treated with NSAIDs, that is we can give aspirin in this patient, and we can also give iron. So these may be helpful, but the best actually the treatment of choice is actually to give the angiotensin receptor blockers and to shift the patient to angiotensin receptor blockers. Then or we can also use a antagonist, which is icatibant. Icatibant is a bradykinin antagonist, so this can also be used along with these ACE inhibitors in order to prevent this bradykinin associated cough and angioedema. The other side effects are the patient might have hyperkalemia, mainly it can be due to renal dysfunction or usage of other medications, um, can be seen. But angiotensin converting enzyme by itself causes hyperkalemia also. It causes hypotension, and then it causes angioedema. One important thing, if the patient develops angioedema, the drug of choice is mainly the adrenaline. The reason for angioedema is same. Angioedema is also due to a bradykinin metabolism only. But for angioedema, because it is a life-threatening condition, first you should give adrenaline to the patient, and then you should shift the patient to the angiotensin receptor blockers. Before everything, you should stop angiotensin converting enzyme inhibitor if you see angioedema in the patient. Then other side effects are the patient develops agranulocytosis can be developed by the patient. Then rashes may be seen due to angiotensin converting enzyme inhibitors. The patient can also develop dysgeusia. Dysgeusia is mainly developed due to the drug captopril.
thank you and thank you for watching.